Intro.
Dr. Juma, the irrepressible head of the emergency medical department, talked at length about how proud he was of the team and the accomplishments that his department had made in the preceding 7 years. He described how Muhimbili National Hospital had become a centre of learning for other health professionals across Tanzania. And so people would come and learn new skills or new methods and new processes and then take them and deploy them elsewhere across Tanzania. Dr. Henry Saw's reputation preceded him. No matter who we spoke to or who had dealt with him in the past, all had immense praise for the work that he did and the effort he had in developing Muhimbili National Hospital as a centre and a seat for learning. Dr. Festo Kayandabila is the operations manager of the Abbott Fund, a not-for-profit that provides support to Muhimbili National Hospital and other providers around the world in 4 key ways. They provide support for physicians to visit Muhimbili National Hospital as well as other developing hospitals around the globe. They support nursing programs, and this is partly how Libby's secondment came about. They also support residential programs and residents, and they also provide tuition fees for those who'd like to undertake masters or other studies but can't afford it. We took an opportunity to visit a new hospital that was linked to Muhimbili National Hospital called the Muhimbili University of Health and Allied Sciences Academic Medical Centre, quite the mouthful. This was a new hospital that was built in a partnership with the South Korean government with a general loan agreement for it to be constructed and paid back. And it really stood out in the middle of nowhere as this huge modern facility. We got to meet Catherine, the medical director, who Libby called a rock star, who showed us around the place. So this was a brand new facility, largely empty because it was still in the middle of nowhere, and we were able to see, the South Korean design in action and in application in this context. And it was a bit unusual in a few places. This meeting room caught my attention. I wondered whether there were people in there who had to make a decision before they were going to be let out. And no matter where you went, whether it was in Muhimbili National Hospital or this place, a picture of the president was inevitably up on the wall in every single room. And his catchphrase, "We only work here." The place was definitely bugged. The paradox between this place and Muhimbili National Hospital kept on coming. The mortuary scene there was only accessible through the outside of the building. And then they also had VIP rooms and VVIP rooms, which featured some fancy gadgets, some of them hidden and some of them probably a little bit more obvious. It was quite impressive to see this ICU for paediatric patients on the one side with 16 beds and then one for adults on the other side of the hallway, also 16 beds. And it sort of started to become a theme where we could see the amount of space versus how many beds were provided and the layout becoming maybe not as optimal as one would like to design in the first instance. The time we took in transit between destinations, sometimes at a complete standstill for up to 15 minutes at a time, proved to be really valuable. It gave us an opportunity to compare notes, share ideas, reflect on what we were seeing, and sort of formulate advice we thought could be helpful for the teams and the senior executive at Muhimbili.
Parts of my discussions that reminded me very much of the culture that we have at Alfred Health, and it was very much around the can-do. Nothing was a problem, there was a sense of urgency and everyone was really invested.